Saving lives and keeping families together, that is the goal and mission of Dacco, the Drug Abuse Comprehensive Coordinating Office here in the Bay Area. Dr. Jason Fields is their medical director. Good morning.
Good morning.
I'm so happy to have you on the show this morning because I think this is an issue where, unfortunately, I think a lot of families are struggling with this. We're going to talk about addiction, and I know one of the messages you wanted to get across is this is a disease just like any other is, correct?
It is a disease. Yeah, addiction's a disease. Many people start using substances volitionally, on purpose to try to cope with problems, be it mental health issues, family problems, financial issues, initially as a distraction to their problems. And if you use any substance long enough, eventually you lose control over it. So addiction is a brain disease. Addiction is any substance used long enough wakes up what's called the limbic system.
Okay.
And that is where we desire food, water, shelter, sex, and what happens if you wake up the limbic system with substances, it overrides the rest of the brain and you're out of control. You're using despite negative consequences.
And this is happening, with families all across the country, certainly here in the Bay Area. I think people have good intentions, but they get kind of mixed up on this on accident. Right. How was your facility able to, and we're going to talk specifically about heroin, which I think is getting into a whole new, realm that we haven't seen before.
Yeah,
but what is your facility, able to do for these people? And maybe if it's not even you, but someone in your family.
We have a wide range of services at Dacco, and it begins with an assessment and referral. So if you or a loved one has someone struggling with addiction, they can come into Dacco and be assessed by an evaluator who takes a lot of information and lets us know what program is best for that patient.
Because there are several different programs, so I'd imagine it's hard to figure out which one is going to be right for you.
That's right. Some people need residential level treatment where they actually stay at the facility and they're removed from their environment. Some people are more appropriate given their circumstances for an intensive or regular outpatient program.
Well, let's talk about heroin, and I guess it's, I'd imagine with the prescription level of this as well, which again is this kind of new epidemic that we're just seeing here recently. Is that right? Is that what your office is seeing a lot more of?
That's right. So Florida was the epicenter of the prescription drug crisis, that was going on, where a lot of so-called pill mills were indiscriminately, without any checks and balances, giving out a lot of prescription opiates and other controlled substances, and fueling addiction. It literally went unchecked, and so people could get very large amounts of prescription opiates. That's really improved. The Florida legislature has put into place laws that make it hard for the pill mills to stay open, let's say. And so with the decreasing number of prescription opiates, unfortunately people are still addicted to opiates and they've turned to heroin. When I started practicing at Dacco about 5 years ago, heroin was limited to the upper northeast United States. Now it's here in Tampa Bay, statewide and nationally as an epidemic.
I think it's important for families and those watching this morning to know that, how prevalent it is in the Bay Area. As we kind of wrap up here, what is your take home? And if it's you or if it is somebody in your family, and I know you have a lot of different options that we didn't even get into of the ways you can help people, but what do you do? What do you do to take that first step to get help?
Bring the patient in, or yourself or the loved one. And if they won't come in on their own and they have an addictive disorder that's threatening their well-being, you can go to your local courthouse and file what's called a Marchman Act. And the Marchman is a legal directive if the judge agrees to get them into the treatment they need.
All right. Well, thank you so much for all of the work that you do here in our community and helping, again, save lives and keeping families together. We appreciate it. We look forward to having you back.
Thanks.
And for more information on addiction or how to get the help you need, you can visit Dacco at the address or visit their website.